Okay, today is the 15th of October 2013, and we're talking with Duane Pretzer and his wife Denise Pretzer, who live in Alanson, Michigan. And Duane has had some health problems over the last year and a half, beginning really in July of 2012. He had a pulmonary embolus from his leg to his lung that was rather severe, and they then put him on some blood thinners, and that wasn't too much fun. Then he got through that, and the pulmonary doctor said, "Hey, you're doing fine." But then he developed some strokes in December of 2012 and in January 2013, and had what's called clumsy hand syndrome at that point, which meant that his right hand didn't know what his left hand was doing, and was kind of miserable with that. He had a little slurred speech, he had difficulty swallowing, he was kind of in rough shape there for a couple of months, but finally that started to get better slowly, and we couldn't figure out what was causing both the vasculitis problems of causing the venous thrombosis in his legs, which had cleared up, and couldn't figure out what was causing the strokes. And also through that he had some problems with his ankles. He had some swelling in his ankles and some pain, and was having difficulty time walking around, could hardly take more than 2 steps without having severe pain. And he had that going on, and took some steroid injections in the ankles, and finally that sort of subsided. But eventually, trying to tie these all together, we ended up seeing about 8 or 10 doctors up here in Petoskey area, and then went to the University of Michigan in Ann Arbor wasn't that in January or February? And by that time we were just really trying to put this all together, and thought that it could be sarcoidosis, and they said yes, it probably is sarcoidosis. After torturing poor Duane for about a week in the hospital, they finally let him go and said, okay, we think it's probably sarcoidosis, and probably even sarcoidosis, and they said, we could make the diagnosis for sure if you just let us biopsy your brain. And Duane said, I don't think so, and said, let's go. So we brought him home, and he fortunately, as most patients do, respond very well to steroid medications. He was on prednisone initially, 40 milligrams a day, and then that was cut to 20 milligrams, and then it was cut to eventually, now it's just 10 milligrams every other day. And in addition, he's on some Plaquenil and some colchicine, I think, but I forget the Colcrisp, which is another arthritic type medication. And he was doing okay. But then, beginning about a month ago, he developed some problem with his hands. And Duane, can you show us your hands and what? Sort of show oh boy, yeah. Let me zero in on those. And yeah, there's one finger, there's another finger, and then he's got some subungual hematomas, which are bleeding under the fingernails. And show us oh yeah, look at that one. Show me that index finger, your right hand, on the other side too. Okay. Yeah, that's
and that one.
Pretty interesting.
Wink. And that one.
Yeah, let me zero in on that. I'm getting a very good close-up view. Yeah, those are... So, we made the diagnosis of severe Raynauds phenomenon with digital ischemia, and he's now on some medication to hopefully dilate the blood vessels. Do we have that name of that? And it's a name that I have a hard time pronouncing, but we'll show that. And he's been on it for about a week or so, and
tomorrow.
And
It's been
Yeah, we'll just zero right in on,
Named by your thumb.
oh yeah, there we go. So there it is. I'm not sure how to pronounce that, but it's in good focus there. It's in great focus. There we go. Okay, so, and that may help a little bit. Duane still has significant pain, but we were really worried that that he had some loss of tissue in the pads of his fingers. This was getting real, like this finger right here, it may be hard to see under the foot, is kind of not only discolored, but
you can feel the difference in it too.
But he's losing some of the pad there, and the tissue is just sort of melting away, which is not good. And I think there was some of that over on this finger too. So, you know, just not necessarily. And when you feel his hands, the fingers are cold, and so we're gonna see what we can do in addition to just the medication, which is a vasodilator, and to help stop the spasms or whatever is causing his secondary Raynaud's phenomenon, which tends to cause spasms in the digital arteries and reduce capillary blood flow. But hopefully we can try something even better than what he's currently on, or continue what he has. But there's some health water that may be beneficial, that help promote microcirculation. And Duane has agreed to be in an experimental trial to see if maybe this might add to his relief. Now, in addition to that, Duane has some problems with his back, and that's been bothering you on and off for maybe for a while, but recently in the last 6 weeks or so it's been worse, I think.
Yeah.
Where 6 weeks ago you were walking 5, 6, 7, 8 miles a day, and now it's pretty tough to get up and move around, and despite the fact that you're on several medications that might help the arthritic problems in your back. But if you wouldn't mind, Duane, if you could just show us how tough it is to stand up, and then I think we'll be done with this segment of the video. And it just is tough. And tell me what, as you move forward and bend forward, is it hurting the small of your back? Is that?
Yeah.
Yeah.
I think that.
And once you get up, standing up even further takes a few minutes before that becomes comfortable, right?
Yeah.
Well, you made it. And now you can just pretend or go ahead and walk toward the door, and let's just want to see how you walk. Okay, well that's good for right now. We'll cut the video off for now, and then we'll do another segment here in a moment.